Assalamu alaikum everyone. I am your facilitator and I am here with the topic of the principles of antimicrobial therapy. So let's begin the presentation. Why antimicrobial therapy or why we use the antimicrobial therapy? Because drug affecting the growth of the microorganism, they help in the immune system to control the infection, most mild and moderate infections. We are giving the antimicrobial therapy for the most mild to moderate infections. Significant portion of the patient would recover without antimicrobial therapy. That means they do not require the antimicrobial therapy. In some infections, the mortality rate is up to 100% without antimicrobial therapy. That means some infections require the antimicrobial therapy. Without that, mortality rate is up to 100%. Infective endocarditis, severe sepsis, relatively safe and non-toxic drugs are present in the antimicrobial therapy. Without antimicrobial, there would be no high-tech medicine. No high technology medicines should treat the infection uh, or any infection or any disease without the help of the antimicrobial. Major surgery, transplants, and immunosuppressions. About what points we concern, or it should better we say, about what point we should concern, or the pharmacist should concern. Host, newborn, infant, non-adults, immunocompetent versus immunocompromised. We should check the patient is obese or not, renal or a liver function is appropriate or not, because if the liver function is not appropriate, we should decrease the dose with the 50% or the basis of the serum creatinine. Patient serum creatinine, allergies, pregnancy, breastfeeding, and also the medicines and the doses should be depend upon the genetics. Antimicrobials are not antibiotic, nor should they be used to treat raise inflammatory markers. That means antimicrobials are not antibiotic, so we should not prescribe the antimicrobials for the fever. Therapeutic plan: what are you treating and which drug are you use for how long? It is also the necessary point for the pharmacist point of view. Massive misuse of the antimicrobials in the clinical practice. So it will reach to the postbiotic era. And what is a post antibiotic era? At this point, we are resistant with most of the antimicrobials because of the misuse of antimicrobial. Origin of the antimicrobials: they are either natural antibiotics, synthetic and synthetic drugs, or the chemotherapeutics, that are the antimicrobial chemotherapy. Naturally, they are produced from the bacteria and fungi. Antibiotic. And what is the correct use term for this? The word antibiotic, because antibiotic are different from the antimicrobials, and antimicrobials are different from the antibacterials, which will further define in the presentation. As a pharmacist, we should aware about the correct terms. Bacteria, antibiotic, the incorrect use of this term but commonly used. The correct term is antibacterial drug. Fungi, that is antifungal drug. Viruses, that is antiviral drugs. And parasitic, that is antiparasitic drugs. And collectively, antibiotic, antifungal, antivirus, antiparasitic, we collectively call as antimicrobials. So antimicrobials are different from the antibacterials. How would we select the drug or regimen on the proper diagnosis? The most likely bug, or we can say that the most likely microbe, community or the healthcare associated infection, accurate history, physical examination, imaging, labs, microbiological tests, antibacterial therapy, gram stain, that is the test we should perform before initiating the therapy, differential diagnosis. After that, we should start our rational therapy. As I say the word rational therapy because the empiric therapies start before the differential diagnosis or the proper diagnosis. Selection of the antimicrobial therapy. Selection of the antimicrobial therapy will depend upon the following points, that are identification of the infecting organism through the gram stain, which is useful for identifying the presence and the morphological features of the pathogen. Identifying the presence in the body fluid that must be sterile is that blood serum and CSF. That means we should take the body fluid for the identification of the infecting organism. Without the identification of the infecting organism, we should not authorize to start the rational therapy. That is a correct guidelines about starting the or selection the antimicrobial therapy. Second point, empiric therapy prior to the identification of the organism. Why it is necessary? Empiric therapy prior to the identification of the organism, because in certain type of the patient we didn't wait for the culture test, like in the case of the neutropenic patients and the meningitis, and in the case of the neutropenic patient the neutrophils count are low and it required the immediate treatment. Empiric therapy, so we if the empiric therapy is made for the patients who require the immediate therapy, and we should not wait for the identification of the organism because that wait will become the lethal to the patient. Okay, here is a question, how we select the drug in the empiric therapy. If we do not have the sufficient data to select the drug, then how should we select our empirical therapy? In the absence of the susceptibility test, the choice of the empiric therapy will depend upon the site of the infection and the patient history. Let's look at this example. Gram-positive cocci in the spinal fluid of the newborn infant is unlikely to be the pneumonia, and which is sensitive by the penicillin G. So here 2 points must be noted down, the age of the patient and the serum fluid from where we take that serum fluid. In the next case, the gram-positive cocci in the 40-year-old patient are most likely by the pneumonia. So here also the suspectable organism is pneumonia, but what is the difference? Difference is the age of the patient, which is also suspectable by the penicillin G, but we should know penicillin G is resistant nowadays because we are in the post-antibiotic era, so the drug of the choice is vancomycin. Third step, determining antimicrobial susceptibility of the infective organism. Some pathogens like the aspergillus and the meningitis show the predictable susceptibility pattern, while on the other hand some don't. So antimicrobial susceptibility test is very important for some pathogens which show the different susceptibility at the different time, like gram-negative bacilli, enterococci, and staphylococcal species. These both three organisms require the susceptibility pattern, and why? Because they show the different susceptibility pattern at the different times, whilst on the other hand some pathogens show the predictable susceptibility pattern, that are aspergillus and the meningitis. So which type of the pathogen required the susceptibility test? Answer is given in the previous slide. Here are the some bacteriostatic and bactericidal drugs. Definition of the bacteriostatic drug: it inhibit the growth of the bacteria and bactericidal, it kills the bacteria. So the drug of the choice, here is a question arise, what is the drug of the choice in the seriously ill patient? In the seriously ill patient, the drug of the choice is bactericidal drug. MIC versus MCB. MIC is the minimum inhibitory concentration, while the MCB is the minimum bactericidal concentration. The lowest concentration of the antibiotic that inhibit the bacterial growth is called the minimum inhibitory concentration, while on the other hand, that kill the concentration of the antibiotic that kill the bacteria under investigation or about the any drug, it's called the minimum bactericidal concentration. This is the major difference. Some drugs are the bactericidal and bacteriostatic always, like chloramphenicol. Chloramphenicol is bacteriostatic against the gram-negative rods and bactericidal against the other organism like the pneumonia. Fourth point in the selection of the antimicrobial therapy, effect of the site of infection. The penetration and the concentration of the antibacterial drug in the CSF will depend upon the lipid solubility. Highly lipid soluble drug cross the blood-brain barrier as compared to the low lipid soluble drug. Molecular weight of the drug. Low molecular weight have enhanced activity to penetrate comparatively than high molecular weight. Protein binding of the drug for the penetration of the drug in the CSF. The drug should be free or in unbound state. Here is a question in the red bold italic. Beta-lactam drug doesn't enter the CSF. Then why it is a drug of the choice in the meningitis? As most of the students should aware about this answer. Beta-lactam drugs doesn't enter the CSF, but it is also the drug of the choice in the meningitis because when the meninges are inflamed, the beta-lactam drugs can easily cross the blood-brain barrier or cerebrospinal fluid. Why vancomycin poorly penetrate across the CSF? You should know about this answer and answer me in the comments or in the chat. Patient factors. Patient factors are also important point for selecting the antimicrobial therapy. Patient factor taken into consideration when selecting an antimicrobial therapy because the dosage and the regimen should differ from the different factors or the patient factors like immune system, hepatic dysfunction, renal dysfunction, poor perfusion or diabetes, age, pregnancy and lactation. Route of administration. Oral route is the best route for the patients who are outpatients and is just favorable for the outpatient. Parenteral route is used for the most serious infection or where the antimicrobial agent of the choice has a poor GI absorption, that the vancomycin, amphotericin B and the aminoglycosides. Concentration dependent killing. Rate of the bactericidal killing increases as the concentration increases from the 4 to 64-fold MIC, and it required the 1 daily bolus. Time dependent killing means it is a concentration independent killing, and increasing concentration to the higher multiples of the MIC does not increase the rate of killing, like beta-lactam, glycopeptides, macrolides and the clindamycin. Administration by extended the 3 to 4 hours, so it required the continuous infusion. Is a major difference between the time dependent killing and the concentration dependent killing. Concentration dependent killing required the bolus infusion and the time dependent killing required the infusion, that is 3 to 4 hour infusion or the continuous infusion. Post antibiotic effect. As the word arises in the mind from the word post antibiotic effect is the aminoglycoside Correct. The post-antibiotic effect is a term useful to describe the suppression of the bacterial growth that persists after the brief exposure of the organism to the antimicrobial, or the simplify. In the simplifying words, the effect of the antibiotic that persists when the drug is discontinued or not given to the patient. For example, aminoglycoside and the fluoroquinones exhibit the post-antibiotic effect. Chemotherapeutic spectra: narrow, extended, and broad spectrum. Narrow spectrum antibiotic, which have a limited group of activity. Extended, which have a significant activity against a significant number of the microbes. And broad spectrum, drug affecting a wide variety of the microbial species like tetracycline and chloramphenicol. Treatment strategy: first, we give the empiric therapy, bactericidal drug, or penicillin G देंगे for the pneumococcal pneumonia. According to the susceptibility of the bug, we give the empiric therapy or rational therapy. Route as defined as previous. Duration depend upon the pathogen. Minimum duration for the 5 days. Why 5 days? Because drug reach to the steady state concentration into the 5 to the 7 days. Atypical pneumonia 7 to 14 days. We should not continue the antimicrobial therapy before the duration of the limited days. Common mistakes we done in the practice or commonly show in the practice: the no culture taken, frequent change of the antibiotic in case of the non-response. We should wait for the response and not change the antibiotic. Think of the undrained collection of the pus, wrong dose, selection of the wrong dose or route of the antimicrobial drug, non-infection diagnosis treated with the antibacterial, over prescription of the some antimicrobial that will lead to all the patient into the post-antibiotic era. Then question of the day: which of the following antibiotic exhibit a long post-antibiotic effect that permit the one daily dosing? Options is gentamicin, penicillin G, vancomycin, and azithromycin. Must give the answer in the private chat, on the WhatsApp number, or below the comments. Thank you.